Hi guys. So in this video, let's learn about staging of carcinoma cervix. So this carcinoma cervix, it's an invasive cancer. It has got 4 stages. Okay. Stage 1, it involves only the cervix. The tumor is confined only to the cervix here. This is stage 1. And this stage 1 is again divided into stage 1A and stage 1B. Okay, this stage 1A, it can be diagnosed microscopically. It cannot be visualized clinically. So it is diagnosed only by microscopy. It is invasive type, that is 1A. And this 1A is again divided into 1A1 and 1A2. This 1A1 has a depth of less than 3 mm and horizontal extension of the tumor less than 7 mm, less than or equal to 7 mm. So this is 1A1. Then what is 1A2? 1A2 is the depth of the tumor is between 3 to 5 mm and extension is not more than 7 mm. This is 1A2. So this is about 1A, 1A1 and 1A2. This 1A is diagnosed only microscopically. And what is 1B? This 1B can be clinically visible. Okay. Again, 1B is divided into 1B1 and 1B2. 1B1 is, that is the greatest dimension of the tumor is less than or equal to 4 centimeters. Okay. And what is 1B2? 1B2 is more than 4 centimeters. So this is about stage 1. Stage 1 means the tumor is confined only to the cervix part. Then coming to the stage 2. Now here the tumor, that is the carcinoma cervix, it extends beyond the uterus. Okay, it extends beyond the uterus but not to the pelvic wall and not to the lower 1/3 of the vagina. So it is beyond the uterus only. Now this stage 2 is divided into stage 2A and 2B. Now what is stage 2A? Stage 2A is without parametrial invasion. Parametrium. What is parametrium? This is a connective tissue on either side of the broad ligament. Yes. So stage 2A is without the parametrium invasion and stage 2B is with parametrial invasion. And again this stage 2A is divided into 2A1 and 2A2. This 2A1 is less than 4 centimeters and 2A2 is more than 4 centimeters, similar to stage 1B, but here in stage 2A this is without parametrial invasion. Okay, and the tumor is extending beyond the uterus. So this is about stage 2, 2A and 2B. Now we'll go to stage 3. What is stage 3? Here the cancer extends to the pelvic wall, that is, and also the lower 1/3 of the vagina, and it can cause hydronephrosis and non-functioning kidney. Okay, this stage 3 is divided into 3A, 3B and 3C. Now this 3A, it involves the lower 1/3 of the vagina, not to the pelvic wall. And stage 3B, here the tumor involves the pelvic wall, that is hydronephrosis and non-functioning kidney can be there. And now the stage 3C. 3C, it is again divided into 3C1 and 3C2. In 3C1, here the pelvic lymph nodes are involved. In stage 3C2, para-aortic lymph nodes are involved. So this is about stage 3. What is stage 3? Stage 3 is the tumor will extend to the pelvic wall and the lower 1/3 of the vagina and can cause hydronephrosis and the non-functioning kidney. And again divided into 3A, 3B and 3C. To the stage 4. What is stage 4? In stage 4, the tumor will extend beyond the true pelvis. That is, it will involve the bladder and the rectum part. Now, what if the bullous edema is present? This bullous edema is not included in the stage 4. It is only due to a lymphatic obstruction. So, do not include the bullous edema in the stage 4. Again, this stage 4 is divided into 4A and 4B. 4A, it involves the adjacent organs like bladder and the rectum. In 4B, there is distant organ involvement. So this is about the staging of the carcinoma cervix. Okay, stage 1, it is confined to the cervix. Stage 2, it is confined to the uterus and not to the pelvic wall and not to the lower 1/3 of the vagina. Stage 3, it extends to the pelvic wall and the lower 1/3 of the vagina, causing hydronephrosis and the non-functioning kidney. Stage 4, it extends beyond the true pelvis and involves the bladder and the rectum. So this is about staging. Now we'll see the treatment parallelly. So for stage 1, what treatment we'll choose? In stage 1A, that is 1A1, we'll go with the type 1 extrafacial hysterectomy. In type 1 extrafacial hysterectomy, we'll remove the uterus and cervix. So this is about stage 1A1. Okay, in stage 1A2, will choose type 2, that is extended hysterectomy. Okay, in stage 1A2 we'll go with the type 2 hysterectomy, and if at all the lymph nodes are involved, we'll do the pelvic lymphadenectomy. And if lymph nodes are involved and you do the pelvic lymphadenectomy, you have to give the post-op radiation. Okay, if at all a young female has stage 1A2 and she decides to conceive a pregnancy, then you have to go with the laparoscopic lymphadenectomy and vaginal trachelectomy procedure. What is vaginal trachelectomy procedure? Here we'll remove the 80% of the cervix and the upper vagina, and we'll cut the Meckenroth's ligament on either side. So this is vaginal trachelectomy, and it should be done in a young female who decides the pregnancy. Okay, this is for the stage 1A2. And you have to check for the sentinel nodes. Sentinel nodes like obturator gland is most commonly involved, so you have to rule out the pelvic lymph node involvement by doing the sentinel lymph node biopsy. So this is about the stage 1A2 treatment. So 1A1 will do type 1 extrafacial hysterectomy, 1A2 will go with the type 2 extended hysterectomy. And then coming to the stage 1B. Stage 1B, in 1B1, that is less than 4 centimeters, will go with the type 3 radical hysterectomy. Or in a young female, we can go with the radical trachelectomy procedure. That is, I have told you, that is removal of 80% cervix and upper vagina and cutting the Meckenroth ligaments on either side, and this is called the cervical circlage procedure. Okay, so in 1B1 we'll go with the type 3 radical hysterectomy. What is type 3 radical hysterectomy? Type 3 radical hysterectomy is also called as Wertheim's hysterectomy or Meeks Obayashi hysterectomy. Here what we do is we remove the entire uterus, we remove the adnexa part, we'll remove the pelvic lymph nodes, medial 1/3 of the parametrium on either side, and upper 1/3 of the vagina is also removed. So this is so called as radical hysterectomy, that is type 3. And in type 3 we have to spare the sacral glands and you have to retain the ovaries, because ovaries are not involved in the cervical cancer most commonly, so we have to retain the ovaries. But what if there is a adenocarcinoma of the cervix? Then we have to go and remove the ovaries, because ovaries are most commonly involved in adenocarcinoma type, not in the squamous cell carcinoma. So this is about the treatment of the 1B1, that is type 3 radical hysterectomy. Or in a young female who decides pregnancy, we can go with a radical trachelectomy. And stage 1B2, that is more than 4 centimeters, also we can go with the type 3 radical hysterectomy, or we can give her chemoradiation. Okay, chemoradiation means radiotherapy with the chemotherapy. Radiotherapy, in radiotherapy we have to give the brachytherapy. Brachytherapy contains cesium and iridium, and following brachytherapy you have to do external beam radiation therapy. Okay, this is also called as teletherapy. So radiotherapy with chemotherapy, that is cisplatin you can give. Cisplatin, it's a radiosensitizer, so you can go with the cisplatin, that is combination therapy, chemoradiation. So this is about 1B2. Then coming to the stage 2 treatment. In stage 2 treatment, in 2A, in stage 2A we'll go with the type 3 radical hysterectomy, or we can go with the chemoradiation. Now you know what is chemotherapy, what is radiation therapy. Radiation therapy means brachytherapy, external beam radiation therapy, and chemotherapy means you have to give cisplatin. Okay, now this is about stage 2A. Now for stage 2B and in stage 3A, that is 3A, 3B, we go with the chemoradiation. Because they are advanced type of cancers, we have to give the chemoradiation. Surgery is not feasible here. Okay, now in stage 4, in stage 4 also we have to do palliative radiotherapy. So this is about the treatment of the carcinoma cervix. Stage 1B and 2A, I've said we can do type 3 radical hysterectomy and we can go with the chemoradiation part. So what are the choices available in stages 1B and 2A? In stages 1B and 2A, you can go with the radical abdominal hysterectomy, that is also called type 3 Wertheim's hysterectomy or Meeks Obayashi hysterectomy. Or you can go with the Shorter's vaginal hysterectomy, that is also called as Mitra operation. Here the entire uterus and adnexa and the vagina, that is most of the vagina and the medial part of the parametrium, are removed in Shorter's vaginal hysterectomy. It's also called as Mitra operation. And combined Taussig's or laparoscopic lymphadenectomy with the short-toss vaginal hysterectomy if at all the pelvic lymph nodes are involved. This is the second choice. And then third choice is primary radiotherapy and give the concurrent chemotherapy. Okay, and other choice is combined surgery and radiotherapy. So this is about stage 1B and 2A. Now coming to a stage 1A and 1B1, where we need a conservative surgery in a young woman who desires a pregnancy. Then what are the choices for us? We can go with the trachelectomy with the cervical cerclage, and if lymph nodes are involved, we have to go with the lymphadenectomy. This is the first choice. And second choice is we have to do transposition of the ovaries outside the pelvis, because if you give any radiotherapy to this patient, ovaries are involved, so we have to spare the ovaries from the radiotherapy, because radiotherapy can cause atrophy of the ovaries or the shrinkage of the ovaries. So we have to do transposition of the ovaries outside the pelvis. And other choices, we have to do oocyte or embryo cryopreservation before you give any chemotherapy to your patient who desires a pregnancy in the future. So these are the conservative surgeries in a young woman who desires pregnancy, that is trachelectomy, cervical cerclage with lymphadenectomy, transposition of the ovaries outside the pelvis, oocyte embryo cryopreservation, prior chemotherapy. So this is about the staging and the treatment of the carcinoma cervix. So guys, thank you.